Hello, my name is Julie Pulerwitz and I'm the director of the HIV/AIDS and TB Global Program here at PATH. This year's World AIDS Day theme is Universal Access and Human Rights. For me, human rights for all means rights for the whole community, whether they be men and women, youth and adults. At PATH, we promote HIV risk reduction and support universal access to services of all types, whether they be diagnostic or care and support or treatment. The way we do this is working in the community, we work within the healthcare system, and we also work with decision makers in government. One example in our portfolio is to promote women's rights and to engage men in understanding and working with men in the community and women on gender equity and seeing how inequitable gender norms and power dynamics can lead to negative health outcomes for both men and women. For example, we're working in Kenya with the Scouts. The Scouts, both girls and boys, to promote gender equity and see how this affects violence and HIV risk reduction. We're working with young women to empower them to try out new roles in their communities, roles that may be traditionally enacted by men. And we're doing the same thing with young men, to have them try out roles that would be traditionally enacted by young women, and trying to reduce violence in the community and in their lives. In China, we're working with migrant construction workers and with vocational students looking at similar themes. In fact, over the last 10 years, we've been doing this kind of work in a number of different countries. And we found that in India and in Brazil and in Ethiopia, that after participating in community-based activities trying to promote gender equity and re-examine the roles and rights and responsibilities of men and women in society, that male participants were much less likely to report partner violence, more likely to report communicating with their partners about these key issues in HIV risk reduction, and less likely to report HIV risk behaviors. PATH is going to continue to engage in these issues as well as other important issues as we are pursuing the goals of universal access to all types of services for HIV.